So it's the beginning of a new training year in the NHS, and a lot of new doctors have resumed into various post training, non-training roles. And I want to start by congratulating you if you are a new doctor in the NHS, that you have worked so hard to get here. Yes, you invested a lot of time, a lot of effort in order to be able to find yourself in this position. And the truth is, there is a lot of opportunities available for you here in the NHS, especially as an IMG doctor. And so I want to say congratulations again. I think I can officially say welcome to the UK, welcome to the NHS. So here in this video, I am here just to give you a few tips that I believe will be very useful to you as an IMG doctor who is starting your journey in the UK generally. And it's very important because a lot of things, if we get them right from the beginning, it tends to make things better as we go along the journey. But if we get some things wrong, it could have long-term impact on our journey in the NHS. So I am somebody that, as a new doctor, I really struggled because of my personal circumstances, and because I wasn't informed. I didn't know that things are going to be different, like very different from where I'm coming from. And so that really affected me, especially for my first, in short, for my first 1 year, I really struggled all through. And that is why I'm doing this. I don't want another doctor to go through all of that experience. And that is why I'm putting out this information. And it's just my own little way of supporting you and helping you through your journey as a new doctor in the NHS. Because some of these tips will be very beneficial to you, especially for your first few weeks or first few months in the NHS. So let's just get right into the video already. Hello, my name is Blessing and I'm a second year psychiatry trainee. And if this is your first time here, I want to say you're welcome. Feel free to become a part of the community. We will love to have you. Working in the NHS as an IMG doctor definitely presents you with a whole lot of opportunities. But then with these opportunities also come a lot of challenges that you will need to deal with, not just as a new doctor, but also as an IMG doctor. And believe me, I'm not trying to scare you, but it can be quite challenging, especially the early days, the first few months in the NHS. Sometimes you will feel overwhelmed, you will feel lost. I'm not trying to scare you, but it's usually an experience that a lot of IMG doctors tend to experience at the beginning of their journey in the NHS. And I'm just here to encourage you, to prepare you for the days ahead. One, so that you can position or put yourself in the right position to be able to take in all of those challenges and be able to respond to them appropriately. And also to encourage you, when you're going through, if eventually you experience any of these difficulties or challenges, to know that you are not the only one. A lot of other persons are going through it or have gone through it. And finally, to encourage you that some persons have been able to survive this phase and have gone ahead to make a lot of progress in their journey as doctors working in the NHS. And if they did, then I also believe that you can also skate through this phase and go to become the thriving and amazing doctor that you really desire to be. And so let me just get right into this video already. So the first one is, I want you to realize that for your first few weeks or your first few months, you might feel overwhelmed, lost, and you might even begin to feel like you're losing your confidence. And that is because there's going to be a barrage of information coming at you all at once. A lot of things that you need to learn. You will realize that there is so much for you to learn. You realize that there is a whole lot of gap that needs to be covered. And not just that, at the same time, while you're trying to figure all of this out, there's also probably going to be pressure from other people, your superior, from other persons who have been in the system, who are expecting you to actually function at the level of somebody who has been in the system for some time. So with all of this happening, it can really be overwhelming for you. You can really begin to lose your confidence and begin to feel very out of place. I don't know if this is going to be reassuring, but I just want to tell you that a lot of IMG doctors experience this at the early phase of their journey. So you're not the only one. But then, what is the position that you need to take? Because I feel like it's not just enough to realize that this might happen, but to also prepare yourself for when it begins to happen. And that is, I want you to keep an open heart, which is a heart that is willing to learn, because you realize that there is so much that you need to learn in a short time. Recognize your deficiencies very early. Like, quickly recognize areas where you are deficient and start early enough, put things in place to be able to close that gap. So I'm just trying to say that you have to intentionally learn, both actively and passively. Make room for learning. There's going to be a lot that you need to learn. Some you will learn from people, some you will need to read yourself, you will have to seek for information yourself. So I'm just trying to say that this is a phase that you need to realize that there's going to be a whole lot of information jumping, flying over your head, and it will be like, oh my god, I'm swamped, but you can figure things out. So how do you go about it? Now, there are some things that you have to learn by reading. Some you will have to learn by watching other people do it. So what do you do? This is the time to do your mandatory training as early as possible. Don't push it too late. Any training that you need to do it on time. You also need to realize that there are some things that you need to learn from other colleagues. So feel free to put yourself in a position of, oh, I am happy to learn from you. Put yourself in that position. Make yourself available when there's something to be done. You may not be able to do it, or you may not feel confident enough to do it, but you can say something like, oh, I'm happy to try this, but does anyone mind supervising me or watch me do it? So it tells everyone that, oh, she really wants to learn, even though she's not sure how she wants to be. So people will be willing to teach you. You're perceived as somebody who is willing to learn. This might be the period where you have to really prepare yourself that I'm going to give a significant amount of my time to gaining new information. So this is the time where you might begin to, read through various trust policies, or go to your intranet to get information about things you are hearing about on the ward. Maybe you are hearing about a certain guideline or a certain protocol. Go and check it out on your intranet. This might be the time where you really have to allocate some time to find out what is the latest management about some conditions, following NICE guideline, reading through NICE guideline, especially for common conditions in your specialty. So this might be the period where everyone might be going on at 5, but you decide to give yourself extra 2 hours because you want to stay back to see how things are done. Maybe you want to stick around to watch, to kind of shadow, because for non-training roles, a lot of trusts usually provide opportunity for shadowing, but for training roles, you don't have that benefit. So you will have to probably create that opportunity for yourself. So you can hang around, maybe speak to the person on call that, oh, I just want to see what it feels like when a person on call. And that is good, so that the day you're going to be on call, you're not just going to be clueless, and you're not going to find it very difficult and very challenging. So this might be that time where you want to stay back, spend some extra 1 hour reading through another colleague's documentation. You want to see, oh, at the ward round today, this was what happened, this was what transpired between the patient and the team. How was this person able to document it in a way that everyone will read and understand? This is the time where you want to read through other colleagues' documentation, especially those who have been in the post, like your specialty registrars, or people who are higher grades like ST2, ST3s. This is the time when you want to do all of that, because you need all of that information within a short time. Because for the first few weeks, people might give that benefit of, okay, she's new, is new, and maybe for the first 1, 2, 3 weeks. By the time you are staying in the unit for a month, people might no longer be that patient with you. They will expect that, okay, you should have spent enough time now, like you need to start delivering and that kind of thing. So it means that you have like a short time to really accommodate a lot of information. Now, I also need you to understand that there are some things that you will learn them as you go along in the process, but there are some that they are really important, they are very foundational, very basic, that you really need to know. Now, the second point, or the second tips, is that I know that some maybe consultants or seniors, nurses, might be expecting you to deliver at the level of a doctor who has been in the system. Now, I need you to understand that, one, don't put too much pressure on yourself, even when that is being thrown at you. You need to realize that you are new, you are subject to mistake, and at the same time, you are entitled to some level of support. Sometimes support can mean that you are not able to do some things, and other people are supposed to help you to be able to achieve that thing. So I'm just saying that give yourself some grace. Don't be too hard on yourself. Maybe there's a consultant who is expecting, or who is feeling like you're not typing as quickly as you should, and so you're delaying the word round. Or maybe somebody is saying, okay, go and do this thing, maybe go and assess this patient's capacity, and you're not confident you can completely do it. It's okay for you to say, oh, I'm not entirely confident I can do it, but I am happy to watch someone do it. I'm happy to accompany whoever is going to do it for my own learning. So I don't want you to put too much pressure on yourself, because if you're not careful, you begin to feel inadequate, you begin to lose your confidence, you begin to feel like, oh, you're not good enough, and a whole lot of that. No, you don't need all of that for your first few months, because you're relatively new, and the NHS is a complex system. It's not that simple. There's a whole lot of protocol, process, and things are not just straightforward as people say it. Sometimes you realize that just to achieve a task, you have to do like 2, 3, 4 paperworks. So I'm just trying to tell you that the NHS is not that simple or that straightforward for a new person to really understand. So give yourself some grace. So don't let anyone put pressure on you. If you're finding it difficult, you can voice out and say, oh, I am not confident that I can do this yet, because this is like my second day. Just let people be aware of your situation. Let them know that this is your first job as a doctor in the NHS. So sometimes when you make it clear like that, people tend to like go very slowly on you and take it easy on you. But even if you find yourself in some situations that are not so in some situations that make you feel uncomfortable like that, then you might want to, just try your best to be resilient, and ensure that you keep reminding yourself that you are not inadequate, you just don't have enough information yet, and you're going to get better at it. The third thing is that as a new doctor in the NHS, you need support. You are entitled to a lot of support, and I'm sure you probably hear everybody saying, oh, we are here to support you, oh yeah, we are here to support you. And I know the confusion sometimes could be that you don't even understand what is the extent of this support. How much support am I entitled to? How should I go about seeking this support? So I think for this, what I will advise is, if you can locate any IMG doctor in your team or in your trust, they might be very helpful, because they have gone through the process already. They know how and what works, especially within that trust. How much support you can get, how to go about getting those support, who to talk to, who to speak to when you need various things. Another thing is to talk to people who you work with. Sometimes your other colleagues, they might be able to tell you, oh, I think you should speak to the HR about this, I think you should speak to this, I think you should speak to that. Seek information about how you can access and harness all of that support, because you definitely need it. The next thing is that, please ask questions. Sometimes for you might feel like, okay, this question sounds stupid, but please, if you think it's a question that you deserve an answer to, or you need an answer to, please ask. And I don't think anyone should raise a brow about it, because you're new in the system and you're going to find a lot of things unfamiliar, and so it is just a normal response that you ask questions. Please feel free to ask your questions. If you find that some persons are uncomfortable with your questions, find people who you feel they are patient enough and they are willing to answer your questions. Yes, ask those people. And it's not just your doctor colleagues. You can learn a lot from nurses, from occupational therapists, physiotherapists, various cadres of healthcare workers, people you work with. Anything that is not clear to you, just ask in a way that is very polite and appropriate, and I'm sure people will be willing to answer you and give. And even if they cannot give you an answer, they can direct you to resources that can help you to find your answers. The fourth thing is, the place of a community cannot be overemphasized. See, even if you are a loner wherever you're coming from, I need you to realize that as a doctor in the NHS, a new doctor, an IMG doctor, you need to be part of a community. And now when I mean community of people that you share a lot of similar characteristics, people that can understand your challenges, that can understand your difficulties. Most likely, even people who have gone through similar experiences, IMG doctors who probably will understand the struggles of a new IMG doctor. And this is very important, because you will definitely need a lot of support from this platform, because as a doctor in the NHS, you need a platform where you can ask your questions without being judged, where you can learn from other people's experiences. You don't have to wait until it happens to you. You can learn from another person's experience. There are so many things that you can gain from being on such platforms. Support in various ways. Another thing that I really need to mention at this point is that as soon as you can, please get a medical indemnity. And this is very important, because for your safety, I think I shouldn't say more than that, but for your safety and for your peace of mind, please get a medical indemnity. And I think there are various types, but it's just mainly about the cost. So I would say go with the cheapest one, except you have somebody who has given you like a positive review about anyone. You might also want to put that into consideration, but a lot of times they do the same things, and so it's just the price that might just guide you in which one you really want to do. So next thing that I also want to tell you is that I need you to prepare your mind that you might at some point experience some racism or prejudice. I'm just trying to say that with the current happenings in the country, it's possible that such things might happen. But although I need to bear in mind that the NHS frowns against racism, but as much as the NHS frowns at it, it doesn't mean you are immune from experiencing it. Sometimes you may not experience the overt racism, it might be the subtle ones and all of that. So I just want you to prepare your mind for it, so that even when it happens, it doesn't destabilize you. You don't allow it to impact on you. And if you feel like you need to talk to someone about it, please do speak up about it. You don't need to suffer in silence. That's just what I'm saying. If you feel like somebody is making you feel somebody is making racist comments towards you and or saying things that are making you uncomfortable, feel free to speak up about it. You could speak to your supervisor, speak to whoever is in charge of that unit and all of that. Just make sure that you get the support that you need. So the last thing I think I'm going to be saying is that as a doctor in the NHS, you are responsible for your own health. You have the duty and the responsibility to look after your health, both your physical and your mental health. Nobody is going to do it for you. If you feel you're not well enough to work, please take a sick leave. You don't have to work, you don't have to go to work when you are physically unwell or when you're mentally unwell. Because if anything goes wrong in the process, being sick does not mean you're going to be vindicated from the consequences of the error you have committed. So I always advise, if you're not sick, if you're not feeling well, let the appropriate inform everyone who needs to be informed, follow the process in your organization, but ensure you take a sick leave and look after yourself, because you deserve that as a doctor, whether you're new or old. Everyone deserves that, because I know there might be the pressure of, oh my god, I want to deliver, I don't want to be seen as lazy. I don't want you to feel that way. I want you to say that, okay, you are a human being and you're unwell and you need to take a break. So there's a whole lot that needs to be talked about, and there's a whole lot that any new doctor in the NHS needs to learn. So it's inexhaustive, but I just feel like this is a good way to start the journey. And you might want to watch some of my other videos. I think I've made a few videos about some of these things I've raised that could affect you as an IMG doctor. You might just want to watch it, gather some of the information there and see how you can apply it to yourself. But try to be as friendly as you can. You know, sometimes people might be talking and you might feel lost, or you might feel like, oh, this does not involve me, oh, my opinion is not really important here, and you might just want to sideline yourself and you just think you're doing okay there. No, in the NHS, that is not a good way to start your journey. Be participatory. Let them see that you are a member of this team, and every member of the team is important. So you are important, your opinion is important, your suggestions is important. Feel free to express, your opinions when it comes to clinical matters, patient management, and even in your relationship with other colleagues and other members of your team. You want to be seen as being friendly. You want to relate with people. You want to join conversations. You want to communicate. Now, I also need to mention here that one thing that I also feel like a lot of IMG doctors tend to struggle with at the beginning is communication. Sometimes it's like, okay, I can't hear what this person is really saying well, and sometimes you also get that I don't understand what you're saying, and it can really be a difficult time. And sometimes your response might want to be, oh my god, since I struggle to hear them or they struggle to hear me, maybe I should just keep quiet a bit more. But that is not the right position. Even though you're struggling to understand the accent, and maybe they are also struggling with your accent, one thing you can do is keep expressing your opinion, keep talking, keep being a part of the team. Eventually it gets better. But if you keep quiet and you sideline yourself, you're going to send a negative message to the rest of the team, and you might end up being perceived as somebody who is unfriendly, you lack team spirit, and that could make things really difficult for you. So I'm just saying that there's a lot to learn, and you might make a lot of mistakes, but that's fine. It's part of the learning process. You make the mistake, you learn from it, and you move on. And so just ensure that you keep learning, ensure that you put yourself out there, ensure that you are participating, ensure that you are visible. Yes, you're visible. Yes, so try your best and ensure that you also find people that you can relate with. No matter how bad it is, I'm sure you should be able to locate at least one or two IMG doctors in your trust that you can ask questions or that might be able to guide you about a whole lot of things. I guess I've already said a lot and I've already put out a lot of information here. So look forward to the Q&A because it's going to be a YouTube live, and we have enough opportunity to be able to talk about our struggles, challenges, and everything, especially as new doctors in the NHS. So this is where I'm going to be ending this video today. Feel free to like, to comment, to share, and also subscribe to this channel. Until I see you again, take care. Bye.